Policy, Personnel Appointments, and Justice and Social Services, Tuesday, February 11th at 6:30 p.m. Roll call, please.
Mitchell. Here. Petrie. Here. Quisenberry.
Here.
Richards. Here. Rosales. Here. Schrader.
Here.
Schwartz. Here. Alex.
Here.
Bergson.
Here.
Carter. Coert. Esri.
Here.
Harper.
Here.
Hartke.
Here.
James.
Here.
Jay.
Here.
Kibler.
Here.
Langenheim.
Here.
Maxwell. McGuire.
He's here.
Michaels. Kurtz.
Here. We have a quorum. Thank you.
Quisenberry.
I'd like a motion for approval of the minutes, January 14th, 2014, please. Geraldo, I need a second, please. Second for Mr. Langenheim. Any discussion on the minutes? All right, all in favor? Aye. Motion carries. Motion carries. I'd like a motion approval of the agenda and addendum, please.
So moved.
Stan and Ralph again? Okay. All in favor? Any changes or additions to the agenda? All right, those in favor say aye.
Aye.
Opposed? Motion carries. Public participation, we have just one tonight. Lynn Barnum, please. Hi, Lynn. Oh, yes, sir.
Good evening, everyone. My name is Lynn Branham.
The microphone, please. Pull it towards you and turn it on, please.
Branham.
Thank you. There you
We
go.
start the meter now. There you go. Thank you. Lynn Branham. I served on the Community Justice Task Force. I also had the privilege of serving on the evaluation committee that looked at the proposals to develop a comprehensive reentry system in this county. That would be for prisoners returning to our community. I was not able to attend last week's meeting. I was attending meetings and hearings of the Commission on Accreditation, of which I am a member. I serve as the American Bar Association's representative. But I did thoroughly review the proposals, and I thought the following feedback would be very helpful to you. The good news is this. If we could combine the proposal of community elements and the Regional Planning Commission, you have a very strong framework, not only for reentry in this county, but to secure a federal grant. RPC has a very strong and impressive planning background, a background in coalition building, which is needed to have an effective reentry system. And the unique feature is using peer mentors, people who have been formerly incarcerated, who have walked in the shoes of the people returning from prison. Community Elements is to be commended for employing evidence-based treatment strategies. A concern I had about that proposal was that there were repeated references to the clients being served as offenders. And that, quite frankly, would be like sitting down and providing mental health services to somebody and saying, how are we going to help you crazy people? It's just not used in the field. So it showed a lack of understanding, really, of the basic precepts of reentry. But whatever your decision is, I'm told that there is a big rush in order to get a federal grant. My suggestion is that to secure that grant, those groups need to apply together. And I was told yesterday that that is not possible because one group would not work with the other. So I called today Tom Stickrath. He is the chairperson of the board of the Justice Center of the Council of State Governments. That is a group that administers the Second Chance Act program. I had dinner last week with him. I served with him on the Commission on Accreditation Corrections. There's nobody who knows that federal grant program better than him. And he told me, and he said that I could attribute this to him. If you want to get the grant, you've got to get everybody rowing in the same direction. Those two groups, the criminal justice officials, we need letters of support. We need the county board to insist on this as a condition of the really relatively small funds that are being allocated by the county for this project. I will do everything I can to bring you all together. I can start this on Friday. I'm going to be out of town tomorrow and Thursday. I will bring those groups together. And if a group will not work with another, that group should not be given the responsibility of reentry for this county. It will never work. I'd be happy to take any questions you might have. Okay. Oh, I'm sorry. I'm sorry. All right, thank you. All right, okay, thank you.
Is there any other public participation at this point? Did you want to speak, ma'am? All right, when you finish speaking, just forward us a little slip of paper there. Thank you.
Hi, I'm Sheila Ferguson. I'm the CEO of Community Elements. I just wanted to reference, or at least
Pull the
make
microphone
reference-
closer to you, please.
I wanted to address an issue that I think Lynn brought up in saying that the two groups wouldn't work together. The two groups actually do work together in a number of different ways, including the continuum of care and a lot of related housing issues. And so I'm not sure where that information came from, but Community Elements works really closely with regional planning on a number of issues in Champaign County. Thank you.
Thank you. Is there anyone else who wants to speak? All right, I'm closing public participation. Thank you very much. Communications. All right, I have some that I'd like to just take a few moments, just two. Thank you. I'm sorry, Astrid. Turn on your microphone, please pull it forward.
The Promise, which is the new name of the combination of Francis Nelson and Smile Healthy, just won the first Delta Dental Wisdom Tooth Award as the best program for serving underserved children. It was a $100,000 prize, so it will be handy, and it's nice to be best.
Thank you. Yes, James.
I just wanted to mention the Economic Development Corporation has opened their search for a new executive director. I believe the deadline for applicants is February 24th. But that's available on their website, the detail of the job description and the deadline. And I will say that there seems to be a focus this time on finding someone who is, if not local, at least regional and familiar with the community and willing to be a very strong advocate for economic development in Champaign County.
Thank you. All right, I have two. 2 weeks ago in Gifford, the village, along with compromised township officials, road commissioners, and other parties, met with two representatives from FEMA and a representative from IEMA to present new and updated expenses from the devastating storm and tornadoes that hit Gifford. I attended at the request of John Dreyer, our Director of Emergency Management, also in attendance. At that meeting, I was asked to preside over the presentation. After about 3 hours of negotiation and another night for FEMA to review the numbers, we were elated that criteria for additional public aid from FEMA had been reached. As you know, new expense numbers from the 9 counties affected also reached the state criteria for reimbursement from FEMA over $21 million. Governor Quinn can now resubmit and has these numbers to the President for approval on January 29th. On January 29th, I received this letter from the President, Darrell Hackerman of Gifford. Al Kurtz, dear Al, I want to thank you for all the help and support you've given us in the village of Gifford in this time of need. I endorse you in your campaign. Darrell Ackerman, President, Village of Gifford. Thank you, Darrell. I really appreciate it, and we'll continue to work together for the benefit of the Gifford residents. Secondly, in compliance with the wind farm ordinance, Inver Energy, the owner and developer of the California Ridge Wind Farm, has submitted the first annual report to Champaign County. I have this letter from John Hall to Al Kurtz. As you know, the California Ridge Wind Farm has been in operations 1 year, and we recently received copies of the complaints from the complaint log for the past year. There were 4 complaints made, and all of the complaints were resolved. The complaints were primarily road-related. There were no complaints about noise or shadow flicker. We also received copies of all of the maintenance records for the past year. Each turbine is inspected twice yearly, and there are hundreds of pages of maintenance records just for the 30 turbines in Champaign County. Sincerely, John Hall. In response to that letter, I called Mr. John Majewski, Director of the Asset Manager at Inver Energy, to thank him for their prompt report. He was surprised. It had not been done before, and he gave me some additional information. At the height of the construction, California Ridge Wind LLC employed 231 workers, directly or indirectly. Now, in its operational phase, the project employs 12 full-time wind technicians, 1 plant manager, 1 administrative assistant, for a total of 14 full-time employees. The average payment for a landowner who hosts a wind turbine is just over $10,000 a year per turbine. This is a combination of the turbine payment, acreage payment, collection system payment, and road payment. That's from John Majewski, Director of Asset Management. California Ridge has a 20-year contract to provide energy to a utility company. I sat down with Mr. Jenkins and revised the tax and revenue that will be generated for our county over the next 20 years. For the Champaign County government, we will receive, as the data now shows, $1,068,000 over the next 20 years. Compromise Township and Gifford, for all their taxing districts surrounding the turbines for school bridges, roads, and other taxing bodies, will receive over the next 20 years $9,952,000. With a landowner's lease agreement, another $6 million. The total economic impact to our county from just 30 turbines will be nearly $17 million over the next 20 years. I asked if there were a plan to expand the wind farm. He would not give me any details, but it was a possibility. I'll continue to work to bring new companies and additional wind energy to Champaign County. Those are my two. Are there any other announcements at this time? Thank you. Let's move on. Astrid, would you please step up? Thank you.
The RFP Evaluation Committee recommends that the Justice and Social Services Committee award of contract pursuant to RFP 2013-006 be awarded to Community Elements. And I further move that the County Board Chair, Sheriff, and County Administrator be directed to negotiate a contract with Community Elements pursuant to the RFP and bring it to the County Board at its February 20th, 2014 meeting. Again, this is a big rush. The federal money has to be applied for by March 18th, so we're out of the money unless we decide tonight and get it done at the board meeting on the 20th. Any discussion? Yeah? Oh. Right. Okay. I so move. Second. Thank you. Yes?
My question, Madam Chair, was we have Community Elements here tonight. I was wondering if we could hear a little bit more from them about their proposal.
That's fine if they are prepared. Yeah?
Move to suspend the rules to allow Community Elements to speak to the board.
Second.
Thank you.
Hi. Oh, sorry.
What? Call. Okay. Can we, all in favor of the motion to suspend? Say aye. Aye. All opposed? They're suspended.
Good evening. I'm not prepared to talk about the whole project in a lot of detail because I know your time is valuable, but I will tell you a couple of very important points that we think are vital to the success of the program. Our proposal does call for an open process and inviting multiple community perspectives. We propose a reentry council, and we guide that with recommendations in terms of the development. It will be made up of multiple task groups, which will be contributing members from all different pieces of our community and certainly from different perspectives, including peer support, reentry population, the concerns of formerly incarcerated persons, neighborhood concerns, law enforcement, transitional housing providers, and all those things that we know are vital to the success of reintegrating into the community. In terms of, it is really, truly our hope that those task groups and the model of a task, that type of task group model will result in briefing memos that can be used to help support the decisions that are made along the way. It also helps to bring a large group together to have some sort of semblance of order of how to proceed through a very complex set of procedures, policies, and different organizations. And that way, we intend to design and implement a process that welcomes community participation, all community members. We also know that it will take multiple service providers, all our service providers. Not one of us can meet all the needs in our community. Our successful system will build on the strengths of multiple service providers, including the faith groups, concerned citizens, and governmental units. Our intention is to seek resources and establish systems that integrate community reentry services in Champaign County. And that really, again, includes all perspectives. So our proposal includes a coordinator who will head up the steering committee and provide the support that's necessary, and documentation and sort of the organization of the work groups and the work that's being done. The second position that we have is a care manager, case manager, who will help assist individuals as they reintegrate, looking at specific individual needs and meeting those needs, whether they are related to housing or benefits, mental health, substance use disorders, or jobs and education. And so those are the two main components that make up the application that we have today. The third piece, which is really a culmination of the work of both, or actually all of us in working with certainly the county, is to look for ways in which to sustain those programs. Community Elements is a Medicaid certified site. We can provide services to people who have situations where they're dealing with the barriers of mental health or substance use disorders, and we can bill for those services. The state reimburses us, which allows us to build capacity within our system as we begin to see more and more people and grow those. It is a small grant in a way, but it's also large because it has the potential to also allow the county and the providers to join together to look at opportunities at the local, state, and federal level. And I think there's been reference to the Second Chance Grant, and we hope that everyone would participate in it. It's not an agency that can submit that grant, it's the county. And so all of our perspectives will be joined together in a very short period of time. So it will be a good example of everyone bringing their strengths to the table and making it the best application that we can.
Al,
Yeah, then Rachel, okay.
and then Rachel, and then
Okay, thanks.
McGuire.
I had my hand up. Thanks, Rachel. First, I want to say I was part of the evaluation committee, and the committee worked very, very hard on this, including Ms. Branham. She couldn't make the final session. We're hoping for her comments, and I want to thank her for those. It was a very good group. We worked very hard, long hours, to review the 3 different RFP responses, and we really talked it over for about an hour as to who we thought would be. And in the group that was in Ms. Branham out of town, it was a unanimous decision for Community Elements. One of the things that I thought was very, very important is their immersion in the drug court, that they've had a tremendous success in already working with parolees and former incarcerated who are in tough times for drug abuse or alcohol abuse, which is part and parcel of what this reentry program is going to have to deal with as well. And they have that experience and expertise over years of working with successful drug court graduates. And I thought that was an upstanding, a very important point. Also, that they're able to provide housing and bring back families together, which is another important area for not for having less recidivism within that group. And as we talk, I want you all to understand how important this grant is. We're talking not about a small amount of dollars here. This is up to $600,000 a year for 2 years. $1.2 million could pay for this program for a long time to come, and we really need to move forward. And the unanimous decision by those at present in that advisory committee, I think, you trusted us to go through this, to evaluate it, and I hope you'll certainly uphold our opinion in that area. I hand it over to Rich.
Yeah, my intent is not to second-guess the committee or question or any of that, so I've not, and having served on evaluation committees, the last thing you want is somebody who has not to come and start questioning. So that's absolutely not my intent. But I'm just curious to know why, we've heard from Ms. Branham today, and we also heard from public participation in the past, how important it is that the person who manages, I don't know if it's the case manager, but I'm assuming that's the title, the person that actually interacts with these people who are served would have background that's similar to them, meaning they've been in that position. And I'm curious to know why you, well, not you, whoever put the proposal together thinks that the qualification should be a bachelor in related field as opposed to having been incarcerated.
Well, it doesn't restrict it, but in terms of billing Medicaid and actually bringing more resources into the program, those are the requirements for the state of Illinois for Medicaid. And so in order to start a program, sometimes you start small and you do what you can to bring those additional resources in, and then you add peer supports and other things as you grow. That's the intention of this grant, and it's actually a model that we've used pretty successfully in our programs. We do have some peer mentors that work with us now, some that don't. And actually, the majority of our residential staff members don't have bachelor's degrees. And so this was a small amount of money looking for a way to really sustain it, grow it, and build that capacity, and know that we will have some shortcomings and some barriers, and certainly there'll be a lot of competition, not only for federal dollars, but even for growing the program within our community, as many of us are struggling right now to cover the costs of our existing programs with the state cuts. And so we have to build where we can, so that's the reason behind that.
McGuire?
So do you have groups now that you're working with that will be part of this program that have some knowledge and involvement in the people that are really a pretty hardcore group that have been incarcerated? And are there groups that you're working with that, you know, it's a pretty diverse group? I mean, we'll be able to work throughout the whole community. I mean, we want to have a positive impact. We're going to spend this kind of money.
Community Elements has
starting-
about 163 employees, probably 90 of which are clinicians. We operate the Time Center and have since 1997. Time Center is a location for most discharges from, or releases, if you will, discharges from state-operated facilities for forensic or people involved with mental health and forensic issues, but also for the Department of Corrections. And so we've had quite a bit of experience over the years. The other area that we have is we already have case managers in place. We're working within the jail system with the sheriff and have for many years. We also are the crisis team, so we get involved with the police departments out in the community, trying to do more prevention work so people don't end up in jails or in the emergency departments. So yes, we have a number of staff, including myself, who I've worked with criminal justice involved clients for 25 years.
But have they been, I mean, these people actually been incarcerated, they understand what it's like to be, you know, like a 12-step program?
We have Time Center Advisory Committee. The council is made up of people who've been in Time Center. And this group, this task force, is the intention around it is to bring people in. So whenever we do work related to the criminal justice system, we try to bring in people who have that expertise and use that expertise. You know, as far as like staff members, I can't really speak to how many people have had involvement with the jail or with criminal justice system off the top of my head. We don't have any peers right now, but this task force is also charged with, the Reentry Council is also charged with trying to bring more people to the table and involve more people from all different aspects of our community, including those with that experience.
Josh?
Yeah, I am certainly not going to second-guess the decision of this committee, and I intend on voting for this RFP. or excuse me, for this issue before us, accepting this proposal. However, I do share a lot of Lynn's concerns, and I think she's certainly a person speaking from a knowledgeable point. If we make, this is the point being that, you know, in a year's time from now, when we work to reauthorize this money or redo this contract, I think if Community Elements has failed to obtain this federal grant we're talking about that we're rushing this to apply for, I think that will feed heavily into my decision as to whether to renew their contract next year or whether to look elsewhere. So I will be voting yes tonight, but that'll with the caveat of I'd like to see, you know, results by next year.
Chris?
I guess I would add to that, I mean, I think a lot of us in the room are probably familiar with the grant application process in one context or another, and what everybody who's ever applied for a grant knows is the ones that are successful are the ones that can staple the resumes of the most experts together and show that they've got the strongest team. So I'm not going to attempt to negotiate the contract here at the county board level. That's the administrator of the sheriff's job, but I definitely think that we should heed Ms. Branham's comments to the effect that the more entities in this community who will lend credibility to that grant proposal that we can get on there, the better.
I agree. Patsy?
Thank you very much. I'm not second guessing the committee, but I was a board member who did attend their evaluation meeting, and I have the sheet showing how the evaluations spun themselves out. Looking at that and listening to the comments of the committee is the foundation for my comments and my follow-up questions. I do concur with what Mr. Alex and Mr. Harkey have underlined, that there really needs to be a breadth of collaboration in relationship to going forward on any grant proposal. And I do hope that this will happen. This is a very competitive grant from what I understand, and we need to stand in extremely good stead to even make the first cut for further reading on as they go through the various grant applications. And because of the way the evaluations sorted themselves out, it seems very apropos to reach out and collaborate with RPC. And the reason I say that, because of the areas where Community Elements proposal and the evaluations appeared not to be as strong, RPC was strong. So the intermingling or commingling of those two entities and their strengths seems to just be almost a given. And again, for those of you who haven't seen this results, it's an aggregation of what everybody said, and it's an anonymous aggregation. So I'm just looking at the data and the numbers and things of that nature, which causes me to underline the comments and the comments from Ms. Branham. I do hope that you will follow through with that and reach out. One of the places in particular that the RPC proposal seemed to be extremely strong and by the evaluators is the strategy for development of community-wide collaboration and support for reentry. And again, I haven't read these, so I don't know what was contained in that proposal, but it seems to me that that is extremely significant aspect of building a successful program. The other place was strategy for development of funding support for reentry services, and those are very important. And as I was trying to educate myself on what is happening across the country in relationship to reentry programs and what causes them to be successful or not, I found a 2009 survey of best practice. It's titled Status of Ex-Offender Reentry Efforts in Cities, and the survey is of 79 cities. And as I looked at, again, that's aggregated data, the successful ones really engaged people who had not only talked the talk, but walked the walk. Okay, now to a few questions that I wanted to ask. I was pleased to see on page 12 of your proposal that the community lacks a set of protocols for data collection and analysis across systems. I found that out myself as I was trying to learn things in relationship to community justice when we started this project 2 years ago. So I'm glad that that's acknowledged and recognized, and I do hope that in this whole process that this can be improved, because when I was asking the questions, what is the large end of the population that might be potentially benefit from a program, and then what is the small end that actually gets into the program? And I never could get those concrete numbers or even unconcrete numbers. And then also in the evaluations, is there really a relationship to what comes out on this end and what could come out on the other end? Okay. And then the other one in particular is the lineup or list, I should say list, of entities proposed for the council. And what I see missing there is there are no community members. Nobody from the community, and I think some people have sort of directly, not even alluded to it, how important it probably is for success and for those of us who have not walked in those situations to have people who have actually walked in those situations and reconstructed their lives to be involved, not in the task force format that you described to us, but up in the council level, that those are the people who are really making the macro decisions. If you take all of our comments into consideration as you work with the county administrator and the sheriff in formulating the grant contract to come back to the county board, I can be very supportive of community elements getting this. But if all of our comments don't get integrated, then I'd have a hard time supporting it. Thanks.
Jeff?
Hi, thank you for coming today. On page, I'll start with just a page reference. Page 15 of your, page 18 in the packet for those on the board. You talk about the initial target population, and really this is for those that are not currently under the programs funded by CCMHB. It almost intentionally excludes, or it actually intentionally excludes all those with mental health and other substance abuse problems for this grant money. Is there a reason for intentionally excluding that group?
The Mental Health Board funding is not to be mingled with other funding, so we made a specific distinction between that. So we have a group of individuals that we're serving now that have been identified in the jail and are being referred back for mental health services. And so we wanted to make sure that you didn't see us trying to fund things that were already funded. That was the reason. It's not really not including people that may benefit from reentry. We just had we have funding to help with some of those populations. I mentioned earlier, we do have people who leave the jail and come into our group homes or into our time center, which we operate. We also have some apartments, so we support people in different ways. We wanted to make that distinction just so that there wasn't confusion over what funding and who was eligible for it.
So at this point, do you feel that the current level of funding, actually, maybe this is an unfair question. I'll just state my thought that mental health should be one of the top priorities for our jail system. But I'm looking at this and saying we're going to do everybody but those with mental health and substance abuse because they already have at least some degree of help. I look at that and say maybe we're missing the target here. Maybe the target should be more focused on the mental health side as opposed to the non-mental health side. And I just want to get your thought as to why that occurred. Now it's making a little bit more sense, but has there been a thought of, I assume there's nothing in the proposal or the grant or anything that precludes us from giving money towards those with mental health issues, correct?
No, it doesn't. And actually, when we talked about data or how important data is, it'll be interesting to see what the profile is when we can bring all of that data together. It's all sort of in separate places. Right now, we're able to meet the needs of those in the jail with mental health related issues. Substance use disorders, we still lack some access to resources such as a detoxification and some of the residential programs that we used to have in the past. And we're also kind of cautious about what's going to happen in this near future. So, for example, mental health services, if they get cut again, we may have to look, and the various different groups, like the Reentry Council, will have to look and see, are we really meeting the needs of that target group, and have there been gaps that have been created because of cutbacks, for example. But within the Sheriff's Office, we're able right now, through that funding that we received this past year, but again, those grants are coming up for review, and those decisions will be made for July 1st. So in the event that perhaps community elements were cut on the CCMHB side, we would have to come back together as a group and look and see, are there gaps created by that funding change? Because those are also competitive as well. And so it takes a lot of braided funding to make this all work. I really like the fact that you prioritize mental health, but that combined with certainly substance use disorders, issues related to poverty and access to employment and education in some cases are also barriers to people successfully reentering and staying well within our community.
And then the final question I had, I apologize, Madam Chair, for asking several questions at the same time. Based upon, well, the big question is why the rush? And I understand there's a deadline for this. One of the things I'm very eerie about is making a big judgment on basically handing over basically $100,000 on this discussion without, if anybody had any major qualms or issues or whatnot. So this is our only shot at doing this, it seems like, in order to get the grant. Can you talk about what the benefits of that grant are versus what we can provide ourselves? What is the catalyst for the rush, besides just the fact that it's just the pure money side? Is that all the rush is?
I think it's probably, I mean, from my perspective, and this is my perspective on this, is there's opportunities that come before you, and they're limited. If you don't apply for them this year, you wait for a whole another year. And so if you prioritize a population like the county has this past year with justice-involved individuals, it's really hard to pass up that opportunity. On the other hand, it is competitive, so it's a choice. You can say, well, we don't have enough information, we can't do it. I'm one to believe that we should take the opportunity when we can. If it's a requirement for the county, and certainly this grant is not being submitted by anybody who received this grant tonight. It's going to have to be a multi-partnered grant that's submitted by the county. We all take responsibility for doing the best job we possibly can. So from my perspective, yes, there's a time constraint that I think puts a lot of pressure on all of us to at least take the opportunity to write the grant and do our best job and compete. So it's up to the county, though. I mean, this is not a decision by community elements, but I really think that if given the opportunity, we'll do our best job for you, and hopefully with all the partners along with us to get the county those funds that we need to keep moving forward.
Kibler, Excuse me. McGuire and then Patsy.
I wish I had that dark hair. Oh. I do suggest that we're kind of rushing into this and the understanding that we want to try to apply for a grant. And everybody's discussed the community elements, and I think they do good work in the community, and I feel that too. The concern I have is that we rush into a grant that some people feel that we won't fulfill what that grant would be, and then we have a program or voted for a program that doesn't fulfill the community need, and then we spend the year with only part of what some people might think is a program that doesn't really fit, bring the community in, and those people that might really address the problems, bringing in the people that might be able to talk to those people that have been in jail more cohesively. It's like we're only getting part of a program that we really want when we can bring in more people, community elements, and RPC and everybody else's program, like Patsy has talked about. What we'd end up with is we'd rush the program, we'd vote for the community elements, we'd rush the program to try to get the grant. We wouldn't get the grant, we wouldn't get the extra money we're thinking we're going to have, but we'd only have half of what we wanted. And that's my concern. When we could wait, try to bring people together and maybe get a program we really need, maybe let it work for a year, apply for the grant, and have it work better for the people we're trying to help with the reentry program. That's what I think.
Patsy?
I appreciate the two previous speakers because they expressed somewhat a concern I had in the rush aspect. We oftentimes get down to this tight wire and we rush our decisions for many purposes. This one happens to be a grant deadline. So my question to you then is twofold. One, you sit down and have conversations with these various entities that we've put on the table for you to consider partnering with, and you all decide that it's not appropriate to apply this year just because all the things are not lined up well enough to really write a strong grant. I mean, we've all been in this situation with grant writing. We rush and the grant isn't as strong as if we had waited and there was more thought that's been able to develop and things like that. So then there isn't that extra cushion of funds potentially because a grant hasn't been submitted. So what I'd like to hear you talk about is how would you proceed for the next year without that possibility, and in your proposal, you're asking for $100,000. And how would that then play itself out for the next year?
Well, one of the things that you'll see in our proposal is the cost of the program is about $126,000, $26,000 of which we've received funding for in-kind services for. I think it would be the responsibility, of course, in this grant and through the contract that this would not be the only opportunity that we pursue. There are a number of opportunities that are coming through the state of Illinois, and certainly both through the Department of Human Services and various other grant parties. And so we'd continue to look for additional resources, even if it were in kind, like we spoke about, through the secular community, or also from the other agencies that bring a lot of resources to the table. And so it doesn't stop with one grant for us. And I know that it seems rushed, but I also know that waiting sometimes is, you miss those opportunities like I mentioned. But there's no really good answer about do you wait and miss this opportunity and see that there's something else down the road. Usually, certainly for our agency, we have a lot of federal grants too. We're working on different timelines, different possibilities, but you do that all keeping in mind what the focus or goal is and what populations you're trying to serve and build your programs. So the committee, the task force, the Reentry Council, and certainly our agency will continue to look at ways that we can improve services along the way. So we see it as a benefit added. This grant opportunity is an opportunity, but it's not the only one.
Rachel?
I just want to remind us all that there was a selection committee that looked at it really careful. To say that we're only rushing to this and that's our only discussion, that's my only discussion, but I wasn't part of the committee. There was a committee that evaluated, thought about it, deliberated, and so on. So that's point number one. Point number two, we're not really approving the contract today. We're sending it to the county administrator and everybody else to negotiate a contract. And so I think we still have a week. If somehow they come back to us and say, you know what, community elements will not talk to RPC, and RPC will not talk to community elements, and the whole thing is going to fall apart, and there won't be a grant, then next week we can still vote it down. But I suggest that right now we voted to move it forward so we can at least have a chance at possibly getting a grant this year. And if Ms. Busey and the sheriff will come back and say, no, that looks like a total failure, then we can still vote it down next week.
Chris?
I had 2 points to make, and Ms. Schwartz just made both of them.
Are we ready to vote? Point of order, we're still in, oh, suspending the rules?
Yeah, we gotta do that.
Okay.
Return to our regular rules.
Second.
All in favor?
Aye.
All opposed? Okay, main motion. Yeah, oh, yeah.
Thank you. I appreciate comments tonight. Very beneficial, and I thank you for coming. Cleared up a lot of things. I'll support this tonight on condition, well, I won't put a condition on, take that back. I will support this tonight, but I'm going to look a little harder for it next week at the county board meeting. I'm going to throw something out that this is, that what I'm throwing out is a primary function of this county board that we've neglected, totally neglected, and that is if we're going to have $100,000 to invest in this program, why don't we have $100,000 to invest in an architect? We have a facilities downtown that's absolutely terrible condition. We're not discussing any of this. This is a situation that's not going to go away. $100,000 will go a long way to get an architect to figure out what we really need to do. And that's not to build more beds. That's to build facilities, maybe, but looking at improving facilities. Facilities that we need, like I said, downtown's terrible. We've got to do something with that, and it feels like we're just not doing a thing. We can't just put up cardboard and plywood in the satellite jail and expect us to have any kind of a facility that's going to be safe for anybody. We don't have proper facility to check on physical and mental conditions once we bring individuals into our correction facilities. We don't have a waiting room, and I don't know what's happened. I haven't asked, but with this cold weather, in the past we've had people waiting outside to get in the visitation. I can't imagine what kind of weather we have, what we have people out there waiting to see loved ones in these facilities. My point is facilities is a pretty primary function of this board, and we're falling very far short of this. So if we're going to spend $100,000 on a program, and Community Elements is doing a fantastic job currently with working with the sheriff, our correction facility, but boy, we really need to dig down and do what we really should be doing. Thank you, Madam Chair.
McGuire?
I guess I'll make one last comment about the comment that was made. Obviously, if we try to move forward with this grant process and getting closer to the discussion about accepting this proposal, then next week we'll have one less week and there'll be more pressure for us to accept what might be the bad plan that we may not want, instead of just making a decision to wait, do it properly, make a better judgment. And that's why we're here, to make the judgment. Even though the committee did do their work, that's why they brought it to us for this vote. Thank you.
Max?
Just, I think everything that you've said in bringing this forward, but it is very difficult with a rush to judgment, using the grant as a lever when, when there's a lot of unanswered questions that really, and facilities, I think, is an excellent point, that being able to take care of those that are incarcerated now, today, in a proper manner, really, I think we really need to look at very seriously.
Thank you. Yep, Al?
Roll call on this issue.
Jeff?
What I heard today was really encouraging from the fact that it is the belief of the groups involved, at least partial of the groups involved, the mental health issues at the jail are being taken care of in a pretty good manner and being adequately funded, and feel like that everything is going well. At least that's what I heard. If I'm wrong, I'm sorry, but that's what at least I feel like. And in my mind, that is a good indication to me that we're doing a good job in that area. And quite frankly, I then go to my next order of priority, and I would completely agree with Mr. Schrader that the next order of priority is making sure those going to visit the loved ones should be taken care of, and everything else falls behind that. So ultimately, because of that, unless there's a shift or a need for mental health or even those afflicted with disease and whatnot in the jail, I'll probably vote no for this evening, in the hopes that if it does pass, that the monies will be more inclusive of those with mental health if the need arises.
Anyone else? Okay, then I guess we call it for a roll call.
Mitchell,
No?
Petrie,
Yes.
Quisenberry,
Yes.
Richards,
Yes.
Rosales,
Yes.
Schrader, Schwartz,
Yes.
Alex,
Yes.
Cowart, Esri,
No.
Harper,
No.
Hartke,
Yes.
James, Jay, Kibler,
No.
Kurtz,
Yes.
Langenheim, Maxwell,
No.
McGuire,
No.
Michaels, Bergson.
Yes.
Carries.
Carries.
Okay. Then I need a motion for somebody to receive and place on file all these reports.
Second.
Any discussion? All in favor, say aye. Aye. All opposed?
Takes care of that. Thank you, Astrid. Appreciate it. Next is Mr. Quisenberry. No, you can't have it. You can't have it. Hey, James.
Good evening.
Power of the gavel.
Welcome to the policy section of the agenda. The first thing we have on our agenda this evening under Section A is an appointment to the Lincoln Legacy Committee for one position, a term that will start March 1st, 2014, and end February 28th, 2017. Mr. Chair, your nomination, please.
Nominate Kay Graybow, please.
I'd entertain a second. Mr. Esri seconds. Is there any discussion? All those in favor say aye.
Aye.
Any opposed, same sign. That motion passes unanimously. Next, we have an appointment for the Summer Number 1 Drainage District for an unexpired term ending in August 31st, 2015. Mr. Chair.
I appoint Arlen Heinrichs.
Have a second by Mr. Harper. Is there any discussion on this appointment? Seeing none, all those in favor say aye.
Aye.
Any opposed, say nay. That also passes unanimously. You will see that in your packet, there's a resignation from Amy Clawbow as a trustee of the Yearsley Memorial Cemetery Association that's provided for your information. Next, I would entertain a motion to accept and place on file the county clerk's January 2014 report. Moved by Mr. James, seconded by Mr. Mitchell. Are there any questions or discussion for the clerk? I see the clerk is here. Seeing none, all those in favor say aye. Aye. Any opposed, same sign. Motion passes unanimously. Next, we have an item on the agenda regarding a resolution number 2958, which is regulation of coin-operated amusements, I bet is I think is the best description of this. I'd entertain a motion for the repeal of that resolution. Ms. Cowart has moved and Mr. Langenheim has seconded. Any discussion or questions about this? Everybody understand what's going on here? Ms. Petrie?
Yes, just a little bit of humor. I hope more people in the community come up so we can find out we have obsolete resolutions, as happened in this case.
Yes, by all means, anybody else find some resolutions we have that don't apply anymore, let us know so we can take them off the books. That being said, I'd like to point out that we're taking laws away at this point. All those in favor say aye. Aye. Any opposed say nay. That passed unanimously. And now we have an opportunity for the county clerk to give us some information about early voting this year. Mr. Clerk. Is that R2D2 you're bringing in?
Kind of looks like it. And there's no way for me to talk and walk around, so that's going to limit the ability to demonstrate the machine, I think, adequately to you and to the audience. So I'm hoping that our crack staff in the IT department can at least focus a little bit on the machine to demonstrate it to the users at home and get a video recording. I'm not going to go into a great amount of detail beyond what was laid out in what is a little bit of a technically overwhelming memo for those of you who don't spend your days in election administration the way that we do. But the long and the short of it is we love early voting in the Champaign County Clerk's office. Most election administrators do, despite the controversy about it. The reality is that early voting is here to stay. And it is simply another choice that voters get to exercise. Voters exercise choices every day in how they mark their ballots and which candidates they support. Early voting, voting by mail, gives voters the choice in how and when and where and at what level of convenience they'd like to exercise their vote. From our perspective, the more folks who vote early or vote by mail lessens the strain on our systems on election day. And so for the big presidential election that we had in 2012, we had almost 80,000 voters countywide, and we had almost no significant issues on election day, and we had no significant issues related to long lines or voter turnout because 25% of our voters voted before election day. And so what would have been 75,000 people voting on election day and 5,000 people voting before election day turned into 60,000 people showing up on election day and 20,000 people voting early or voting by mail. And that strain makes things easier for us, it makes things a lot easier for our election judges, and it makes things a lot easier for the voters who go to the polling places on election day. So in 2012, as you know, we expanded early voting to a great degree in Champaign County, introducing 7 new locations. That was the biggest expansion of early voting in Champaign County's history and the largest expansion of early voting by any jurisdiction in the state of Illinois in 2012. It went really well. We had a record number of voters in the ballot boxes by election day. Unfortunately, we had to compromise in order to pull that off, and the compromise was, and you may remember that we discussed this during the county board meeting, was that the 7 locations would only be able to handle voters from a limited geographic area. Instead of only having 1 location that could handle everybody in the county, which we still had here at Brookins, we wanted to spread that load out a little bit more evenly, reduce the line in any particular location, and give more folks across the county geographic proximity to a location where they could vote early. It went very well, but even at the time we were implementing it, we're looking for a better solution. Our old equipment couldn't handle voters the way that we wanted to. Our ideal situation was early voting locations that could handle any voter in the county at any location, and that just wasn't possible with our old equipment. So we did a lot of research, and we identified a new piece of equipment from the same vendor. This new equipment is called the DS200. It is federally and state certified, which means it's been very rigorously tested for an enormous amount of time, gone through enormous legal hurdles in order to get that federal or state certification, and was federally certified in the summer of 2013. We immediately requested a demonstration of it and some demonstration units. We looked at a couple of other manufacturers, but we quickly settled on this in no small part because it uses exactly the same ballots as the machines that we currently use. It uses exactly the same software as the machines that we currently use for Election Day voting. That means voters don't have to get used to a second ballot style. It means we don't have to manually combine any election results on Election Day. As you can imagine, we're reluctant to manually combine election results on Election Day because it introduces human error, it introduces paranoia, and so we'd like to stay away from that, combine everything within the software. And so tonight, I'm here to answer any questions you might have, let the public know that our plan for the March primary and for every future countywide election in Champaign County is to continue operating 8 early voting locations in Champaign County. The primary one being here in our office. Secondarily, we'll be at the Illini Union. We'll be at Spalding Recreation Center on the north side of Champaign, Meadowbrook Church in southwest Champaign, Grace Church of Mahomet, the Rantoul Recreation Center, the St. Joseph Village Annex, and the Tolono Public Library. And for the March primary and every future countywide election, our intention is that every voter in Champaign County can vote at any early voting location that is most convenient for them at any point during the early voting period. We think that is the next logical step in the evolution of early voting in Champaign County, and we're excited to offer that service. So questions? Would anybody like to see the machine operate?
Mr. Rosales.
How many of these did you purchase for our early voting?
We purchased 12. We'll deploy 9 of them for any given election of early voting. We will use 2 here in the office. Even though any machine can handle all of the precincts in the ballot, the office location is still our busiest early voting location, and we don't want to have a backup at the tabulator. So we have 2 machines at either end of the voting room so that if one machine is being used by a voter to insert the ballot, a voter can use a second machine so there's no wait. And as you can see, the machines read ballots relatively quickly. So we have 9 machines we use for Election Day, 2 here at the office, 1 at every one of the other 7 locations, and 3 backups.
Mr. Schrader.
Will you said the software will be the same as our current voting machines. Are the ballots going to be the same? And
Exactly the same ballots. So the same ballots we've used in Champaign County since we got the optical scan tabulators in 2005, 2006. And the other, that's an additional feature for us. We can use these machines to audit the M100s. We can use the M100s to audit these. If somebody votes by mail, their ballot can be read by the DS200 here in our office. It can be read by M100. If we have all of our DS200s break down, we can use the M100s to count the ballots. They're cross-compatible.
I appreciate you saying that too. So you've got backup. You've got hard copy backup. You've got the old machines to back up your information and everything, so.
And we're still going to use the M100s for Election Day. We have 126 of those, and I mentioned it in the memo kind of obliquely, but for those of you that pay attention to this stuff, the President of the United States just had a Presidential Commission on Election Administration that just issued a report. And one of the significant findings of that report is that every election jurisdiction in the United States of America bought new, modern election equipment in 2005 and 2006 with, money from federal Uncle Sugar, which is great. It modernized elections across America at the same time to a tremendous degree, and we're very happy with the M100s that we have. They've been very reliable, very accurate machines for us. We're very happy with them. The concern is that every jurisdiction in America has equipment that's all going to die at the same time. And, we're not asking the county board for an appropriation, but certainly we want to get that on your radar, and we want you to be aware that one of the considerations for buying 12 of these is it allows us to take 24 M100s out of service, use them as backup machines. God forbid if it comes to that, we can use those machines for parts to try and keep the other machines alive as long as we can. We had been at a point where we were using 124 of 126 machines for any given election, And that's just not sustainable for us.
Just one quick question. Will the new machines improve the speed at which you calculate, tabulate voting results, so we won't be here all night here at Brookins?
No. Because remember, we're still going to use the M100s for Election Day, and the delay, if there is a delay in results on election night, it's inevitably because we have write-in candidates. And with write-in candidates, there is no choice but to count those votes by hand. They're the only votes that by design have to be counted by hand. We can still count anything in Champaign County by hand. We have paper ballots and paper voter applications, so we always have a paper backup in case we have a power failure or the world comes to an end. But write-in candidates, and unfortunately for the primary election, we have 2 write-in candidates, including yourself, Mr. Schrader. But we have a countywide write-in candidate for the United States Senate on the Republican side that means that every precinct in the county, the election judges are going to have to stop at the end of the night and manually search through every ballot that's been cast in the precinct to look for write-in votes. And that just slows things down.
If the world comes to the end, I'm not worried about how fast you count the ballots. Mr. Hartke?
Yeah, I would just say that from my own personal point of view, and probably from most people in the county, getting election equipment paid for by the federal government would not necessarily be candy, since that is a way of expanding the franchise of voting, and most people want to expand the franchise of voting. So I think classifying that as candy is probably a little unfair.
That's not what I said, but
would classify it as candy, I would believe, Mr.
Okay. The point being is that 10 years ago, the federal government showed up with a large pot of money for every election jurisdiction in the country.
Yes, they did, and you referred to it as Uncle
The-
Sugar.
The problem is that when all of this equipment starts dying in 2020, I don't know that there's anyone in the election administration who's optimistic that that same or a similar amount of federal money is going to be available again. And so, as a jurisdiction that is responsible for election administration, we want to be proactive about making sure that we have a long-term plan for our capital needs for election equipment, without relying necessarily on the federal government.
All right, any further questions? Mr. Richards?
Absolutely. Mr. Holgren, your grace period early voting procedures that you used in your office last election have been made illegal by the General Assembly. What procedures are you going to be using for grace period same-day early voting this year?
Grace period voting was one of a number of changes that were introduced in the General Assembly in a large election omnibus bill, and they mandate that local election authorities permit folks to register and vote the same day during the grace period. And so that's the procedure we'll be using in Champaign County.
Okay, but are you doing anything special with the ballots? Are they going straight into the regular pile?
Regular pile.
Well, I know you were very concerned last election about verifying the ballots, and that if somebody walks in the same day, you're not going to be able to send them a piece of mail and wait to see if it comes back.
That's correct.
What is your office going to do to satisfy those concerns? And obviously for early voting, somebody who's already registered can walk in and vote. Somebody who's not registered can walk in. Grace period, same day register. How are you going to work that out?
We're going to follow the law,
Okay.
just like we did in 2012, just like we do for every election.
All right, next I have Astrid.
What about election judges? I mean, your employees were acting as the election judges at the early voting last time, and they told us that we would have to settle our problems with you. They wouldn't even look at copies of the law. Aren't the
I'm
election
sorry.
judges supposed to be independent?
Election judges, by law, under Illinois law, cannot be independent, actually have to declare a party affiliation. And for the early voting location in the office, we have used, in accordance with the law, deputy county clerks to serve as election judges. For presidential elections, we hire temporary employees from the list of election judges that are approved by this county board. And as happens on election day or for early voting, whenever there are procedural questions that election judges aren't comfortable answering on their own, they're instructed to contact our office. Or, you know, if it's a legal question that we're not comfortable answering on our own, we'll go to legal counsel.
So that the election judges being your employees is okay? I always thought they represented the voter, not the...
Specifically permitted under the law for early voting in the office of the election authority.
I see, thank you.
Mr. McGuire?
With the question with same-day registration, maybe the question he was trying to make is, how do you make sure that the voter hasn't voted in, say, Chicago and now is trying to vote in Champaign or?
We do not have any way of verifying that prior to the voter casting a ballot. Our experience is that is exceptionally rare. We do extensive post-election audits, and every instance where we find suspicion of somebody who has attempted to vote in multiple jurisdictions, we refer to the federal authorities.
Ms. Petrie?
Just an information question. What is the approach you're going to take to let people in the county know of this advancement that you've made in how people can avail early voting?
Thank you. That's an excellent question. I'm hopeful that Mr. Kasich will give it some coverage in the News Gazette. We intend to. We intend to conduct a media campaign when we get closer to the March 3rd opening of early voting. But again, this is the final committee of the whole meeting before the opening of early voting on March 3rd. One thing I'd like to note is that the early voting location here at our office will open on that first day, March 3rd. All of the satellite locations will open the following Tuesday, March 11th, and run for the final 5 days of early voting. Based on our experience with turnout, we're convinced that that's sufficient to satisfy demand for the fall general election, and for larger turnout elections, we'll run all of the alternate locations for the full early voting period like we did for the presidential election. We will, in addition, mail, as we have in the past, a notification to everyone who has voted early or absentee in Champaign County since the 2008 presidential election, reminding them of the opportunity to vote by mail, the opportunity to vote early, the locations and the schedules for doing so. This will be publicized in the News Gazette according to the law, and in the large election notice insert that we publish in the News Gazette on February 24th.
All right, Mr. Langenheim, you're next.
Yes. Could you give me a precise or an estimate of the number of cases of attempted multiple voting you've had in this?
Less than 10. Less than 10 in the 3+ years that I've been here.
Less than 10 in 3 years.
Less than 10. And I have never been contacted by federal authorities to follow up on any of those, so I suspect they get circular filed.
Thank you.
Ms. Michaels?
I just wanted to say that we really appreciated having the early voting in Rantoul. I know that the gentleman that usually is one of the election judges actually goes out and makes sure he tells all of his buddies at the coffee shop and whatnot. But also something for a reference too is that I did note that it also was on the website. So if people do go and look up how to cast votes for that type of thing, it is on the website too. And so that is another avenue that is already being utilized. But certainly word of mouth within our community has been very, very well accepted. And thank you very much.
Thank you. The best practice of election administration is to do this consistently, multiple elections, even though for an election like this one, it may seem like it's a little bit of overkill. The idea being that we want voters to get used to having an early voting location at the Spalding Recreation Center or at the Tolono Public Library, so that they take advantage of it even in the off-year, low turnout elections. But more importantly, they'll tell their friends about it when the major general elections happen on even years.
Mr. Alex?
Just going to say, it's been my experience that candidates, especially those in contested races, do quite a good job of letting their constituents know when the election is and how they can vote.
Thank you, Mr. Holden.
Thank you, Mr. Quisenberry.
Okay, moving on. Our next section, Section C, Information Technology, there is a recommendation for amending our IT resources policy, which basically says you have to choose passwords that are somewhat more complicated than before, which is a good policy to have, I would say. Anybody want to move that change? Mr. Esri? Ms. Petrie seconded. All right, any discussion or questions? All those in favor say aye. Aye. Any opposed say nay. That motion passes unanimously. Next, we're moving on to the Section D, Regional Planning Commission. We have a item here that would authorize discussion about a intergovernmental agreement with the CU Mass Transit District. And Deb, is it okay if I let you give a little bit of the background on this?
Actually, Rita Black is here from RPC and is in a much better position to give the full background on it.
Move to suspend,
You have to suspend the rules. You're allowed to call.
oh, that's
Okay.
true.
Come on up, Ms. Black. And please use the microphone for the benefit of the public.
I actually have a presentation.
Okay.
Okay. I decided to make a, good evening, everybody, first. I decided to make a presentation because I know that there are a lot of new faces that are not familiar with the rural transportation services that Champaign County has been providing for about 3 years. Then this will give you a background about the services, and then we can discuss the agreement or the recommendation for entering into an agreement with CUMTD. Since back in February of 2011, Champaign County started providing rural transportation services in Champaign County. The area that we have been providing, oh boy, this is really sensitive. The area that has been receiving rural transportation services is the yellow area that you see on the map. The gray area is the area where CUMTD is providing transportation services. The funding that is provided by IDOT for transportation services is divided between rural and urban, and that's why we have the separation between the two areas, and we have different providers for both areas. This is more or less the way that the system operates. When we started providing the service back in 2011, the service was mostly concentrated on this area, the northeast quadrant of the county. And you can see here the fares that were put in place at that time and that are currently in place. Basically, the services provided are provided by CRIS. This is the agency that was at that time selected to provide the service. The hours of services are from 6 in the morning to 6 in the afternoon. Recently, that started just back in May, that we started providing services earlier and later. The average number of trips for fiscal year 2013 was about 69 trips. The majority of those trips were medical trips. Boy. No. Medical trips, but it was interesting that in fiscal year 2013, also 20% of the trips were employment trips for the first time. And we have about 1,500 people registered as riders of this service. 10% of them are disabled, and a quarter of them, 25%, are seniors. You can see here more or less the trends on how the services have been provided since back in July of 2011. The services started in February of 2011, but we started counting the riders once the system was in place in July, and you can see more or less the trends. You can see that recently we have decreased the number of rides that we are providing, the number of trips that we are providing, and this is due to some issues on hiring drivers for the buses. We map the major trip origins. As you can see, most of the trips are originated in the area of Rantoul, because that was the concentration that we have at the beginning, and as well as on the smaller communities. The destination, of course, is Champaign-Urbana, because it's where we have a highly concentrated number of employees and medical services. Back during the summer, we had public bus going around the community, basically to do the long-range transportation plan to collect information on transportation services in general in the urbanized area. But even though we were collecting information about the urbanized area, we got comments also about the service provided by Chris and the needs that people outside of Champaign-Urbana have for transportation. And as you can see, these are more or less the comments that we received. Mainly people were asking for extending the service hours, and also people were concerned about having to schedule a trip 48 hours in advance. They were asking for having that done 24 hours in advance. All the people that talked to us recognize how good the service is, but they wanted something even better than that. Based on what I put on the memo that you have on the packet, back in March of 2013, IDOT contacted all the counties, sent a memo to all the counties receiving funding for rural transportation. And they were changing some of the rules for the counties receiving rural transportation. And one of the requirements was to put in place a staff person to oversee the way that the system is operating. This staff person needed to be a county employee or needed to be an employee of the agency providing the service, but in the particular case of Champaign, because the service is provided at this time for Chris, then it couldn't be an employee of Chris, had to be an employee of Champaign County unless we joined Chris MTD to provide the service. Knowing all these difficulties, we started talking to some of the providers around Champaign because we didn't know what Chris was going to do at that time. Then we started talking to mainly one of the requirements from IDOT is that if we are going to work with a provider, need to be a provider that is contiguous to the county. Then we contacted, the first provider that we contacted was Piatt County here. They have Piattran, is the service that they have. And then we contacted also Rights MTD that cover Edgar, Clark, and Cumberland, and another 15 counties to the south. And based on the conversations that we have with them, we put together a list for you of the pros and cons of each of these different agencies that we contacted in terms of helping us to solve the problem that we had at that time regarding providing the service and having the PCOM person. Regarding Piattran, they are already a county department. The way that they do the accounting system will be a good benefit for Champaign County because they charge full direct administrative to the grant that they use to provide the service. They have really good management for the transit agency. They have IT technology for the vehicles that they are using, which could be a benefit for Champaign County. And they are already providing 4 daily trips to Champaign County. The cons of having Piattran to provide the service for Champaign County, and they were really clear about this, is that they, at this time, building a new facility that will start this spring, this summer, and they told us that to provide the service for Champaign County at this time will be really difficult for them because they are in the process of dealing with the facility construction, and they couldn't, and they were also dealing with the new impositions from IDOT, the new requirements from IDOT, then it was going to be really difficult for them to do that. And the other difficulty that we'll have if we go with Piattran is that they provide some fringe benefits for their employees. Then Champaign County will be required to provide some benefits for the employees of the transit agency. Then we talked to Rights MTD too, the managing director of Rights. As I already mentioned it, Rights serve about 18, 19 counties to the south of us. It's a huge mass transit district, which will allow for a faster transition taking over Champaign County system, because they are already prepared to do that. They are well known for the policies that they have in place to provide transportation services. They are nationally recognized. They also have the benefit of being part of a large insurance pool, which will reduce the cost of insurance for Champaign County. And they already will be able to provide a structure where they can have a dispatch only for Champaign County, which will facilitate providing the service to the riders in Champaign County. The problems that we see will have on working with rides is that we will have to be annexed to rides mass transit district, in the same way that we'll have to be annexed to Vermilion Mass Transit District to be able to operate under the new rules of Champaign County, of IDOT. The other problem that we saw working with rides is that Champaign County, due to the size of the counties that they serve, Champaign County will have very little representation on the board that they have. Then we will not have a voice, basically, on the decisions that are made at that time. And the other problem that we will have is that they are already serving more than 17 counties. At this time, I believe there are 18 that they are serving. Then we really don't know how they will approach serving a new county. It will take some time to get to the level that we have now with Chris. Then we talk also with CUMTD. I don't know if you are aware, but MTD is already providing the maintenance for all the vehicles that Chris is currently using. They are also housing all the staff for Chris. There are all the offices of Chris are already in the CUMTD facilities. They have several employees that are from the rural areas, which will help on providing the service. And as well as rides, they are part of a large insurance pool, which will reduce insurance costs for Champaign County. And the way that we see this is that the governance structure that we'll have with CUMTD will be similar to what is already in place for the County Public Health District. What we are proposing is that MTD will work on the same way that we have it with CRIS. That will be an agency that we are selecting to provide the service for Champaign County under contract. Will not be an MTD, which we will not be part of an MTD, which is the case for CRIS for rights. The difficulty that we have at this time is that on July 1st, they will be changing the managing director, and then it will take some time for them to know when they will be able to take over the system for Champaign County. I will give you some information that will be useful for you to make the decision. At this time, the budget that we have from basically federal grants to provide the service is Section 5311 funding on this amount, which will be similar for fiscal year 2015. We have state funding on this amount, which will be similar for both years. JARC is a funding to provide job access trips. At this time, CRIS received the funding for operating the system, but is not utilizing the funding because they don't have the equipment to be able to provide those trips. And this is the amount, $50,000 is the amount of operating funding for that grant. New Freedom Grant, we applied for a grant for this amount, hasn't been confirmed yet, which is a total of more or less this amount. Then what the intergovernmental agreement will entail. We have to submit a grant application in April to IDOT requesting the funding and basically telling IDOT what kind of services we'll be providing. And at the same time, and I put it on the packet that I sent to you, we have to comply with the new requirements from IDOT, which is having the PCOM person, and the PCOM person will be a staff person from RPC, which will oversee the responsibilities, part of her responsibilities will be to oversee the operation of the system and take care also of all the requisitions and all the financial aspect of the system. The agreement will extend from July 1st of 2014 until June 30th of 2015, will be 1-year agreement. And the fundings that are going to be used are the fundings that are already listed. And also the agency selected will pursue contracts like the contract that currently Chris has with the nursing home for services that will be local match funding for the grants that they are receiving. And at the same time, if we sign an agreement with MTD, a new vehicle lease will have to be established with them in the same way that we have it with Chris at this time. The other element that I want to mention is that we, in these past 3 years, have submitted several grants to IDOT requesting equipment, requesting vehicles. At this time, we only have 5 vehicles that are property of Champaign County. Chris is allowing us to use 2 vehicles from Vermilion to provide service here in Champaign County. But at the end of this year, hopefully by fall, we'll have another 12 vehicles coming to Champaign County, which will allow us to expand the service in the future. And when I say expanding the service, this is what we would like the agency taking over the transportation system to provide. We would like the service to start at 5 in the morning and end at 7 in the evening, because that's the feedback that we have received from the residents. And the service to be provided from Monday through Saturday instead of being Monday through Friday. The request for rides instead of being 48 hours to be 24 hours. To implement the route between Rantoul and Champaign-Urbana for work trips, at least for the 4 trips a day, and to have a more affordable fare structure, and to define guidelines for rider complaints, and to have more marketing and outreach in the community. Any questions?
Actually, before we go into direct questions, I want to point out a couple of things. First of all, I'd ask that you provide that presentation to Ms. Busey so it can be added to the website, both for our benefit and for the public's benefit. The other thing I want to point out is we're not making a decision tonight.
No.
What we are doing here is authorizing the discussion of a creation of an intergovernmental agreement, which would go through the normal process of the county board getting a chance to review it, ask questions, and proceed or not proceed based on whether they liked it. So I think some important points to distill from the presentation is that there are other options that have been looked at as far as how to continue this. The current option is not available going forward. So without changing who we work with to do this, this is a resource that would go away. And I'm not sure anybody wants to see that as a possibility. So that being said, that clarification being made, I saw Mr. Alex with your hand up earlier.
No.
Use your microphone, please.
I'll move that we send this to the full board with a recommendation for approval.
Moved by Mr. Alex, seconded by Mr. James.
And at that, if I could speak to it.
Yes.
I had a couple
ahead.
of questions. Why does Chris want out?
We have the manager of Chris here if you want to hear from her.
Sure. I don't think so. We'll call him a vendor.
Okay.
Putting them on the spot.
There are 2 chairs there, so plenty of room.
She's done a wonderful job.
Thank you. Chris got involved with this project when there were several years of committees established in the Champaign County area to establish transportation in the rural area. Chris got involved in that project probably about a year and a half before it got off the ground in 2011, and assisted in moving, along with all the other committee members, through the very complicated process called a primer process to establish a rural transit system in the rural area. And we were part of the committee, we were part of all of the organizing, we did a lot of the legwork alongside some RPC staff, and we're just a natural organization to step up and help get this thing started. And so we did, and we're very proud of getting it off the ground, and it's really time for it to grow. The goals that are listed are very reasonable goals for moving forward, and it's just time to transition.
So, but Chris will continue providing the service in Vermilion County? Is that
Yes, sir.
the
We've been
intent?
doing that for 40 years.
Okay, so this is essentially sort of retreating to your, or resuming your primary mission, you'd say?
Sure. We're just continuing, and there's some expansion going on there with a lot of different projects, facilities, et cetera. And we just have extended our hand and will for as long as needed to be a good neighbor.
Okay, that's understandable. And we certainly appreciate the efforts that you've put into it already. I don't know which one of you is the appropriate person to answer this, but there was, at one point you said if we were to sign on with this RIDES MTD, and I don't know if potentially Pyatt, if you mentioned this or not as well, that we would have to annex into that district. Can you describe sort of how that works? I mean, what I'm hearing is we should contract with the MTD so that we don't have to annex into this rural district. Now, I understand that this would be a contract with the MTD. We wouldn't be annexing the county into the MTD, but into the CUMTD, obviously. But why would we not have to have the same type of district in effect that we'd have to annex into if we joined Pyatt or joined RIDES? Is there not a requirement that this district exists in order to provide service?
It's basically the new requirement from IDOT that if we are working with another county, the provider could be department of the county, and they will be handling everything, and that will be the case of Pyatt County. They will provide the service for Pyatt, and they will provide the service for Champaign as a department of that county. Or if we join another agency who is already an MTD, if another agency is selected that is an MTD, we need to join them.
Okay, so we're not required to form an MTD in
No.
order to provide this service?
No.
The reason that we would have to annex to RIDES to work with them is because they are already an MTD?
And that's the case of Chris too.
Okay, so Chris is becoming or has already
They
become
are already an MTD.
an MTD, but we have not annexed into Chris?
No at this time, but with
Okay.
the new rules, we'll have to.
I understand, okay. So the proposal here is that we would contract with the MTD, but we would not establish an MTD for the rural county?
Exactly.
Okay. What implications does that have as far as being able to do trips outside the county? I mean, you mentioned that Pyatt does trips to Champaign County. Obviously, Champaign's a big county. If you live in Ivesdale, it seems like you're just as likely to work in Beament as you are to work in Champaign. So to what extent can we work with other counties to provide transportation other than just from point to point within Champaign County?
Well, usually the funding provided is to provide transportation within Champaign County, but if there is the possibility of providing trips outside the county and there is demand and there is the willingness to do it, can be done. And that's the case of Pyatt County, for example, and Vermilion. They do a lot of trips to Champaign County.
Yeah, can I add to that?
Yeah.
Champaign County is new. Pyatt County has been around for a long time, just like Vermilion, and so they have a larger fleet of vehicles. And it's just going to take some time to build a fleet so that you can go the other way. Most calls are wanting to come into Champaign more than people in Champaign wanting to go out. And so it's just been important to focus on where the primary need is.
Okay, then one more question, I'll shut up. We Just to clarify, Champaign County owns these vehicles, right?
5,
Or owns other than the ones that were being lent to us by Chris from Vermilion County,
Yes.
Champaign County has vehicles of its own.
yes.
So if we were to agree with if we were to contract with the MTD to run the service, we would be leasing those vehicles to the MTD.
Exactly.
And then paying the MTD to operate them. And they would not, the MTD would not be able to use those vehicles for providing their service in their district, and they would not use their existing equipment to provide service for Chris. These would be
No.
totally, or excuse me, not Chris, for the rural transportation
Yeah.
programs. These would be totally separate fleets.
Yes, there is, as I mentioned at the beginning, there is a separation between the rural funding and the urban funding. They cannot mix together the funding from the two different sources. They will have to have separate accounts for the rural service and for the urban service.
Okay, thank you.
Ms. Petrie?
Hi. I have a few information questions, but I am sorry to see Chris pull back to Vermilion County, because without Chris, we wouldn't be having this conversation this evening. So again, it was fun being the liaison to that group for a while. Okay, my questions are the following. When you listed the pros and cons under CUMTD, I would not put the structure of the county health as a pro. I would put it as a con. I would really hope that there would be another organizational structure to be discussed on that score. Second, I do understand from the data that you presented that the concentration has to be around Rantoul, though I do have a concern that there were other citizens within the county that were serviced by Chris, and you haven't mentioned, and you don't have to tonight, but sometime explain to us how there is a plan to service those people and not just leave them without some alternative. And then my last question is, you mentioned toward the end of your presentation the potential toward the fall of having 12 additional vehicles. Is that grant money that you see coming on, that's on the horizon?
Yes.
That to be used to purchase
Yes.
those? Okay.
Yes, we already got the approval from IDOT to obtain those 12 vehicles. We are just waiting for the vehicles to be delivered.
All right.
And regarding the service, Chris is already providing service to the whole county, not just the northeast quadrant.
No, I know that, but if Chris isn't here, then.
The idea is, as I said, that the service will be at least the same.
Mr. James?
Quick few comments, because in caucus, we talked about it, and of course, taxes always comes up, but Rita, you can tell the group, because this is all grant money, there is no tax money
No
from the
tax.
county going into this. Chris has done an excellent job, it's been a up and down thing with some of the rules and the changes in IDOT, it really had nothing to do with Chris per se, it was more or less the rules. But I just want everybody to be mindful, because Diane's asked me questions and others have, that the county's not putting any money per se out of our funds for this. We are working with RPC, and then we'll be whoever we go with. We've discussed this tax deal. It won't happen unless down the road the board changes its mind and the other villages, but they can't go in and just start annexing farmland and what have you. Also, my last comment would be that the Board of Health was a very fair comparison.
Mr. McGuire?
If there's 4 buses coming from Rantoul, is there more of a chance that people named James will be down here too?
Riding the bus?
All right, I don't see any other hands up, so I'm going to ask, call vote, and I'll remind you that we're voting on sending this to the full board with a recommendation that the discussion occur to develop an intergovernmental agreement. That does not mean that we are passing an intergovernmental agreement. It just means we're authorizing the talk to occur that would find one potentially for us to review later. Okay? All those in favor say aye. Aye. Any opposed say nay. Motion passed. All right, thank you very much for the information.
Thank you.
And that passed unanimously, by the way. Moving on, we'll move into the county administrator section, and I would entertain a motion to accept and place on file the Administrative Services January 2014 report. Moved by Mr. Kurtz, seconded by Mr. Hartke. Does anybody have any questions for Deb, or Deb, do you have anything you want to call out? All those in favor of accepting and placing on file, say aye. Aye. Any opposed, say nay. Next, we have, in your packet, there is an update to the intergovernmental agreement for the GIS consortium. The short description of these updates are, the agreement was reviewed in light of Open Meetings Act and Freedom of Information Act changes that have occurred over the last several years, and it was found to be wanting, so it was edited to accommodate those changes. It is, and it's my understanding that all of the parties to the GIS consortium have reviewed it with their legal counsel to make sure it makes sense. Deb, do you want to add some commentary here?
No, that's accurate. Before the GIS Policy Consortium voted on this, Policy Committee voted on this, the legal from every single entity had reviewed it, and that took months to get that done, but it was finally accomplished. And all agreed with the language as it is presented and highlighted for you on pages 68 and 69 of your agenda. Those are the changes. So the next action is to take it back to each of the governing bodies to have it approved.
And so I would entertain a motion to approve this as edited. Mr. Hartke? Seconded by Mr. Langenheim. Are there any questions about the changes in particular or in general? Seeing none, all those in favor say aye. Aye. Any opposed, say nay. The motion passes unanimously. Next, we have a recommendation for approving the second of potentially 3 years of renewal with the consulting company Gallagher Benefit Services, which we have been using to help us with employee benefits. I would entertain a motion for this item. Moved by Ms. Petrie. Second by Mr. Schrader. Any discussion or questions about this item? Ms. Petrie?
Yes, this question is for Ms. Busey. I brought it up at caucus. I just want to make certain that this agreement will allow, should it be appropriate, for a conversation of aggregating health insurance.
Yes, there's nothing about this agreement that would preclude that, and we are already scheduled to participate in that discussion that's being initiated by RPC.
All right, thank you very much.
Other questions? Mr. McGuire?
So this is the second year, so we're talking about 214, and it talks about a 3% increase being attributed to Affordable Care Act fees, and some of the Affordable Care Act has been pushed back. Will that mitigate the cost of the insurance? And maybe that's not a question anybody can answer here, but.
That is what went into our premium increase that went into effect on December 1st. Mr. Malakowski is here. I'm not sure if you know the answer to that question or not. We are paying those fees to Health Alliance at this point.
My name's John Malakowski with Gallagher Benefit Services, and I'm sorry, the question again was?
Maybe those are just the fees that, it's for the Affordable Care Act that are already in place, but some of the changes in the Affordable Care Act have changed, and they're pushing some of the charges back, and I was wondering if some of these that are listed here are some of those charges.
Reporting requirements and that have been pushed back, but the fees and taxes associated with your plan have not changed one bit, and they're continuing to be paid by Health Alliance and being charged to your plan.
Okay.
So,
Okay, thank you.
And I just wanted to clarify, we initially had a 2-year agreement, and last year we renewed for 1 year, and this would be a second renewal for 1 year, and we have a third option in our original RFQ
Correct.
that would allow for that if we so choose, okay?
Correct.
At what point do we put another RFQ out, after this next option is accepted?
Yeah, well, I'm not trying to tempt fate here, but we could choose to do that now if we were unhappy with the service or we thought we could get a better deal out there in the market. If we renew tonight and we renew a year from now, after that third year, we would be required to go to another RFQ. Other questions? All those in favor say aye. Aye. Any opposed, say nay. That motion passes unanimously. Next, the last thing on the regular packet under this section, item number 4 is we have a recommendation from the Job Content Evaluation Committee with regard to the public defender investigator position, and I believe that recommendation is that it's a Class H,
Correct.
and it is a non-exempt position.
Correct.
And so that coming back, we have been asked to approve that in policy. You'll see another thing in finance with regard to this. There is no salary impact or budget impact by approving this, just so everybody knows, and likewise with the finance item. So I'd entertain a motion to move this. Mr. J moved, Mr. Hartke seconded. Any questions or discussion? All those in favor say aye. Aye. Any opposed, say nay. That motion passes. I want to switch to the addendum at this point. You took my addendum.
No, that's his. He took mine.
All right,
Mine
anyway.
disappeared, too.
Anyway, so we have a similar item on as item number 5 under the addendum. In the process of reviewing the investigator position that we just voted on, it was determined that the state's attorneys, the senior state's attorney investigator position, probably should be reevaluated as well on the basis of exempt versus non-exempt. That is the concern. And the recommendation was to do that when the incumbent left or retired, and the incumbent is retiring. So we have that opportunity now. So tonight, what we are being asked to do is to send this to the committee to be evaluated. It will come back again with a recommendation, so we'll see it again. I would entertain a motion to do so. Mr. Hartke, Mr. James seconds. Any discussion? All those in favor say aye. Aye. Any opposed, say nay. That also passes unanimously. That is the last item on our regular agenda. I just had an item here for the chair's report. It's time again for you to take your online Open Meetings Act training. We get to do that every year. If you have questions about where you're supposed to go to do that, I'm sure Ms. Busey would respond to an email query regarding that. It's also pretty easy to find if you know how to use Google. So I have Mr. Richards.
I think we'd all appreciate knowing what the deadline was for that.
Yeah. If you haven't done it yet, you're in trouble. I think, I don't know what the penalty is, because I don't know if anybody's been caught yet with regard to that.
The sheriff has not arrested anyone for this
Yeah.
at this point.
Well, and I don't want to find out what the penalty is, so.
That's not, always
All right,
sensitivity.
let me look at this. It looks like for policy on consent, we'd have A1 and 2, and we'd have B2, C1, D1, E2, E3, E4, and that would be basically everything that. E5, thank you.
Thank you.
Oh, yes, that just goes straight to the committee. Just throwing me off there. And that is all for policy, Mr. Chair.
Thank you. I'm thinking about, because before Mr. Alex comes up, I'm taking a 10-minute break. For everyone, it's 2 hours. 5 minutes. 5-minute break. 4 and a half minute break. Next up is page, where are we? Page 2, Finance. Mr. Alex, take it over, please.
Thank you, Mr. Kurtz. Thank you all for sticking around for finance. The first item on the agenda, as usual, is the treasurer. So I will hand things over to Mr. Welch. I would like to have a motion to accept the treasurer's monthly report and place it on file. Moved by Mr. Kibler and seconded by Mr. Schrader. And take it away.
Thank you. There's an item coming up on the agenda for the resolution to authorize a loan between Public Safety and General Corp. You've done this for several years, but I thought I might take the opportunity, and it might be helpful to you to know what General Corp's cash position is today and what it might be at if we go forward, maybe up through June. Just give you an idea of where we are and how things are going. So I passed out a piece of paper, a little gray sheet there that starts with December 2013. Of course, we're into the third month. And it goes out to the June of 2014. This is what I use every day. I post every check, every deposit, and try to get a projection of what the cash position would be at any particular point. And so it looks like, if you remember, the last 3 years, we actually made the loan in April of each of the last 3 years. And I'm predicting, if you could look at this, it looks like maybe that's going to happen again this year. But it also gives you an idea of how much a payroll is, and it's $1.6 million every month. And when you look at the accounts payable and the monthly revenue figures, those are averages of the last 4 years. But of course, the payroll is based on for example, 5 payrolls we've already had so far this year. And it also takes into play real estate taxes, which come into play in May. So it gives you an idea of what the cash balance was actually at the end of December, January, and we're, of course, partway into February. And remember, this isn't budget figures. These are cash figures. It's not what we should have. It's not what we will have. It's what we do have. And I like to call that the real world. So if there's any particular question about that, I'd be glad to answer it.
Any questions for the treasurer? Ms. Schwartz.
Just one question. So that's assuming the loan, or that's without?
That's without the loan.
Without, okay.
Mr. Kibler.
I think you just put me down a rabbit hole. I'm sorry, my friend. So can you explain where on this particular sheet that we actually have the loan incorporated? So the loan is not actually mentioned at all in this?
Right.
So why do we need a loan?
Well,
If our cash position never gets below $840,000 in May of 2014?
If you're asking my opinion, I would say that whenever you have a monthly ending balance less than 1 payroll, I think that's a good idea to be looking at that. Because it's not about the bottom line, it's about the timing of the bottom line. It's about when the money comes in. And this is about not figuring out if the state's going to pay us or anything else kind of things. This is based on averages of the last 4 years, telling us that we're expecting this kind of revenue, this kind of accounts payable during the month. We know what the payrolls are going to be. There's 3 payrolls in May, yes. So it just gives you an idea of where the trouble might lie. And my belief is that if any particular month ends around what the total payroll would be for that month, that's a good idea to start thinking about. You may need it during that month, and that's been true
So
for the
what
last
is it,
several years.
if we were to have a goal of trying to avoid borrowing this money,
Sure.
what would the goal be? 2 million plus? Or
I think,
20%
yeah,
more?
we've talked about that, yeah. Right now, the county goal is 12.5% of the expenditure budget. That's what we hope that the ending year carryover would be. And I think that that's going to have to, that's generally been around $4 million. If we had a $4 million budget balance in the general corporate fund at the end of the year, we probably wouldn't have to borrow before tax money starts coming in again in May. I think what we're going to find is going forward that maybe that number needs to be 5 or a little bit over $5 million. Does that give you an idea?
Yes, thank you.
Ms. Schwartz.
Just to clarify, this is not really a loan. right? We are moving
No.
numbers on paper, we're not even moving money from anywhere to
I look at it
anywhere.
like a
Yeah,
line of
but-
credit.
Right, and so for me, the importance of calling it a loan is to say, public safety sales tax should have a minimum balance. It should never be spent below, because that's our backup for general corp. But you're not really talking about a loan, there is no interest, we're not borrowing from anywhere else. It's simply moving funds from here to there.
I agree with your assessment. It's a matter of semantics, is that what we're talking about?
Anything else for the treasurer? Seeing nothing, all those in favor of accepting the treasurer's reports, placing it on file, please say aye. Aye. Anybody opposed? Thank you, sir. May I have an omnibus motion for these two resolutions regarding mobile home tax sales? Mr. Quisenberry and Mr. Hartke. Sorry, Stan, a little too slow. I want to, you have anything to say about these?
Just briefly, we've done these several times. So they're mobile homes that went to a tax sale. No one purchased them. The redemption period expired, and we put them up for an auction, and the people paid a minimum bid to get them.
Sounds good. Mr. Kurtz?
I'll be happy to sign those for you, no problem.
That's good to know. Any other comments or questions? Seeing none, all those in favor, please say aye. Aye. Anybody opposed? That motion carries. Thank you, sir.
Thank
And we'll
you.
speak to you about, if we have additional questions about the public safety sales tax, we know where to find you.
Sure, thanks.
Moving on to the auditor's report. May I have a motion to accept the auditor's report and place it on file? Mr. Kurtz and Mr. Jay. Take it away.
If anyone has any questions about the report, I don't anticipate you'll see the FY13 numbers change much, as we had our final check writing on January 29th. So all of the bills that we're going to attribute to FY13 have been paid and are reflected on this report.
Thank you. If there are no other questions for the auditor, all those in favor of accepting the report, please say aye. Aye. Any opposed? That motion carries. Thank you, sir.
Great. I passed out the purchases not following policy. If anyone has any questions, please let me know.
Okay, we normally take that up at the full board, but feel free, Ms. Petrie.
You've been doing so exemplary in limiting the number that we see on the sheet, and this time, workforce development seems to have quite a few. Is there a short explanation of?
Short explanation is that these were all vouchers that were sitting on an employee's desk, and they were turned into us too late to make the January 29 AP run.
Okay.
So they were FY13 bills paid this year.
Okay, thank you.
Name and shame. Thank you. Thank you, sir. We'll move on to the nursing home monthly report. We have Mr. Maxwell's memo was sent out by email. We have the report in the packet from the nursing home and MPA. I would start with a motion to accept those and place them on file. Mr. Langenheim, and I didn't hear a second. Ms. Petrie. Any comments, questions with regard to the nursing home? Mr. Hartke or Mr. Maxwell like to have the floor? Mr. McGuire.
Yes, I have a few of them, actually. I guess, I don't know why Mr. Gima doesn't come now, but, because those are some of the questions I have are for him, and they have to do with turnover rates for the employees, which seem to be significantly high in reading this report, whether you accept Mr. Gima's numbers or the numbers that the union brought to the attention of the board. 40% if you use Mr. Gima's numbers, and 60 or 70% if you use the numbers of the union. When we're talking about how the nursing home is perceived, dietary, all those types of things that bring the census up for the nursing home, it seems like it would be an important subject for us to address, how the employees are treated and why there's such a high turnover rate. Dietary, and another issue seems that they discuss in the report that the cost for hiring the dietary SDS at least $10,000, if not more, $22,000, something that they should be doing themselves, managing the dietary. We had them hire another company to do that work, and now it seems that they are not, SDS is not following the MOU to do that work. I'm wondering what the situation is there, how we can improve this situation, what Scott Gima plans on doing to correct these issues, and, more support for the employees.
If I can make a comment, Mr. Gima will be giving the quarterly report next week in this room. So this is really, I mean, he typically doesn't come to the Finance Committee, unfortunately, but he will be giving his quarterly report. I'm going to let Mr. Harkey go because he's our liaison, and then I'll get Mr. Kurtz, who's been jumping out of his chair.
Yeah, Jim, I have some of the same concerns you do regarding employee turnover. And I have an email exchange where I'm working with the AFSCME representative. The name is slipping right now, Michael Whitmore. For one thing, the county is in violation of its own living wage ordinance with some of the employees working at the nursing home. They are being paid below the living wage we established as a county. So I have some problems with that on a basic level. I also, and from Michael's conversation, it's low pay that seems to be the main concern of employees that are rolling over. I would agree. I would like to find room within the budget to do a good contract this year. We're currently, in negotiations as a labor committee right now on this. When we do, though, everybody has to remember, if we work on increasing employee pay to improve employee morale, to improve the conditions at the nursing home, to then allow for more people to be there and turn the financial numbers around, we're going to have to be given some leeway in there where the financial numbers are not going to look as good because we've increased pay, because we've increased payroll. So it's a double-edged sword, but your concerns, I, as a member of the nursing home board and as a member of the labor committee, I have very strong concerns about that, and I hope we'll be able to address those in the contract negotiation.
Thank you, Mr. Harkey. Mr. Kurtz, did you want to say something? Okay, Ms. Bergson.
I thought I read somewhere on this that in their comparisons with other nursing homes, then other nursing homes, they were using the actual wages, and ours included overtime, so that it was deceptive.
Does anyone feel qualified to answer that? If not, that may have to wait until we can talk to Mr. Gima about it. Mr. Maxwell?
I don't know that I can answer that question. I think that's something that we're going to have to look into. And people look at numbers and they come up with different conclusions. So I think we need to take a look at that and see what the AFSCME represent, the point that he was trying to make the other night, see how that is squares with what we're showing on our surveys. Thank you.
Thank you. Now, Mr. Kurtz?
Yeah, thank you. I have some concerns. I turned it off? Okay. There was some concerns with the SDS, with the new program, and Mr. Gima will address those next week, and he's going to handle that, hopefully, very shortly. Also, I did notice that our census is up. We had a pretty good month in December. A couple of $100,000 plus, and our star rating went up. So, I mean, that sounds like there is some positives going on. Let's not be critical of everything that's happening there. And at least we're seeing some positives, especially on the financial side and on the rating side. So I'm sure Mr. Gamer will give us all that information next week.
Mr. McGuire.
Yeah, and I think that's true. I think we're doing a better job. I think we're kind of at a ceiling, though, and the dietary issues keep us, and we hear this throughout the community, from pushing through that number. And the issue of overtime, I've heard the same thing. But obviously, if 60 to 80% of our employees are leaving, there's a situation with their pay. They're not staying here because they don't want to be here. So it has to be addressed. Thank you, Josh, for discussing.
Thank you. Ms. Petrie.
Thank you very much. I was at the nursing home board meeting the other evening, and I do attend all of these. I did have a chance to speak with the ASME representative and 3 employees who were at the meeting. I encourage the employees to work with the ASME representative to put together their major concerns to bring to the board of directors, because that seemed to be the appropriate conduit for them to get those into the pipeline so there can be a conversation at the board of directors. I won't, it's up to them to bring them forward, so I will not elaborate on what they shared with me. My concerns about the pay is that until the AFSCME representative brought forward a new analysis of the figures, we were not really getting a true picture of what the pay for the people, for the employees at the nursing home. So that was a major concern for me when I heard the differential of the figures. I have a second concern, and that has to do with dietary and the problems there. There is a contract. I'm not in a position to ask questions during these meetings, but my question would have been, are we paying them on this contract when they're not delivering, or has there been some question about the payment out to that contract? So I do hope next week Mr. Gima can address some of those questions.
I think Mr. Harkey has something to say to that.
Yeah, on the SDS contract, yeah, this is something we talked about, was it last month, 2 months ago, we passed this to move on this. That's a very short time to say whether, they fulfilled their the requirements of the contract. They are not completely there yet. Mr. Gima has made them very aware. He's also, I know, moving forward on solutions to end the contract if they fail to make progress on some of our concerns. I will say this, that even Don Lynn, who's a member of the board of directors recently appointed, who has both his mother and mother-in-law there and is quite there often, and here's a lot of input, said at the board that the quality of food issues have been resolved. I mean, people are pretty happy with the quality. The problem is the actual delivery of the food, how quick it is, and is it warm? And that's a very valid concern. Currently, the management, and we talked about this last night, is working on a contract with a specific system for food delivery. This is coming out of money we budgeted in our budget at the nursing home, in our capital improvements for dietary improvements. My understanding is the main one they're looking at is a pellet system that keeps the plate warm. But they are moving forward on implementing a system. Again, it'll take a little while to get it fully in, and we will be following up on it to see if it works.
Thank you, Mr. Harkey. It looks like we're starting to wrap up here. Mr. Kurtz.
I'd like to throw it open to Josh, Gary, and even Jeff. We seem to have concern about turnover. Are turnovers also in the private sector of other nursing homes as much? Are we so unique that we stand out among nursing homes in turnover, or is turnover something that is just occurs in that career, so to speak?
Mr. Harkey.
I think this is where we're coming to a difference of opinion on whose numbers are correct. Scott's numbers say we have a 40% turnover, which the national average is 45. However, some of the numbers AFSCME are producing are showing that we have closer to a 60% turnover rate. To me, neither one's really acceptable. But I think everybody is aware, especially if you've had family or friends who have either lived in or worked in a nursing home, that it is not the easiest course of career in your life, and pressures can build, and people, need to get away from it for a while. It's a tough business. I think paying our employees better would make up for that.
Thank you, Mr. Harkey. I'm sorry, Mr. Maxwell? Mr.
I'll
Killer.
address the turnover issues a little more. Many factors go into turnover. Again, Mr. Harkey noticed in 2011, the average national rate was around 45%. Other issues such as employee satisfaction with supervision, and these sort of things. And employees need to take certain things away from their job that do not include money. Money is a big issue, I realize that. But they need good supervision. They need to be appreciated. And some of these things, I think that we can work on at the home, and I think our patients would appreciate that too. I've sensed that talking to some of these employees, they really are dedicated, many of them that I've talked with. So I think that it's there. I think the employees are in place if we can just get them to stay. Thank you.
Thank you, Gary. Mr. Kibler.
I think Gary stole my thunder. Ultimately, since you requested it, it's ultimately what we make this. There are, just from my brief history and all this, that depending on the quality of the facility and many different factors, that includes pay, that includes just the general environment that you're in, and includes the administration and how well the administration gets along with its employee base. There are so many factors that go into turnover, especially in this type of facility, that it's not an easy answer, which is why Josh's statement earlier was so spot on, that we may have to do things like raise the pay, which may have an ouch at first in terms of our bottom line, but eventually it will come around and become better. So I think there's a lot of factors that have to come into play. I apologize, it's the first time I've heard the 40 or 60%, so I'm kind of surprised that there's such a disparity between the two. I think that needs and warrants much, much more investigation.
I have Ms. Michaels, and then Mr. Richards, and then Mr. Langenheim, and then Mr. McGuire.
Well, I'm on another subject here. I'm looking at the beginning of his report, and it says that the cash balance went from $684,000 to $367,000, which is an increase of $317,000. And the first sentence says that his census climbed by 7, which is the exact amount that the Medicare showed an increase of. And I just felt like that was an awfully large number for 7 people to be the swing on that. So maybe he can address that when he comes at the full board.
I mean, there's a lot of timing that goes into revenues and expenses, so they may not necessarily correlate. Mr. Richards, I think you're next.
I do think we should be following our living wage ordinance, but I wanted to get back to Mr. Maxwell's comment. Gary, you named a number of intangibles that you said would improve staff satisfaction. Are you saying that we're wanting in that at the nursing home and that we need to be doing that better if we want to keep people?
I believe there's some general consensus that we have some important positions that haven't been filled over there, and at the supervisory level. And I think we can get those positions filled on a permanent basis so that we have good continuity of employees. I think then the employees that that are subject to high rates of turnover would appreciate the stability that good supervision would give them. Everyone benefits from good management.
Thank you, Mr. Maxwell. Mr. Langenheim.
Two questions about turnover. Is this per annum, turnover per year? And what employees does it apply to? Wage employees or all employees? Or is it service employees? Does it involve nurses, nurses' aides, what?
Does anybody know the answer to this question? Ms. Busey says all employees.
All employees.
All employees per
That
annum.
includes the RNs? No. Is there any way of breaking that down by level of employment?
I'm sure there is.
If it's 50% and it's all coming from hourly workers, it's one thing. If it's 50% and it counts to all of them, it's something else.
Agreed.
just curious.
Some more clarity on the numbers would certainly be useful. Mr. McGuire, I think you were next.
Sure. It's all employees. And from my understanding, it's, they were given information about the number of employees that had left and did a percentage based on those numbers that left during the year.
Okay. Would it be fair to say if it's all employees, then it mostly refers to employees in the lower ranks.
Not if it's all employees. It'd be everybody, but dietary lost 36 employees in 1 year. And there's not that many employees in dietary.
I mean, it's certainly my impression that turnover tends to be higher in the lower paid positions over there, whether that's by the nature of the position or because of the pay is hard to say.
Well, it's like Gary says, if you don't have good management in certain areas, they're going to turn over faster, there's going to be more problems, and the situation's going to be,
Thank you, Mr. Guire. I'd like to wrap this up if there are no further comments. I'd just make one, and that's with regard to the labor negotiations. I'd ask the board to keep in mind that we do have active negotiations going on with ASME over this contract. So to some extent, I think it's great to ask questions and make sure that we're working from the right set of numbers, but at the same time, we need to make sure that we're letting that process proceed. So thank you. I would ask all in favor of accepting the nursing home report to signify by saying aye. Aye. Any opposed? That motion carries. Our next item is item D1, the Regional Planning Commission, who's very patient representatives and sitting back there. This is the request. I would request a motion to approve the 2014 countywide residential electronics collection agreement. Moved by Mr. James and seconded by Mr. Jay. Any comments you'd like to add?
I'll respond to any questions. Everything's moving into place very nicely. Parkland College is very willing to be considered as a host site. We have a recycling contractor who's very qualified, one of the few left in the state who can process televisions at an efficient cost. So it's working out very well, planning.
Thank you. Ms. Petrie has a question?
Yes. I noticed that it was mentioned that it's becoming more and more difficult to set this up. We certainly appreciate the effort you do and doing it. So 5 years or 3 years down the line, what do you think we're going to be doing to handle this kind of recycling, or do we just throw up our hands?
Well, when I talked to you last year, I had fully expected to scale back our collections from 2 to 1. This year, 2013, has been interesting in that many of the recycling contractors had cut back their acceptance of television due to the processing costs of the cathode ray tubes. I see that statewide a trend. It's sort of in fluctuation right now, and things will calm down. I think there's new technologies to use the CRT glass that are coming into place now. I think things will improve over the next year.
Thank you. Do we have any other questions or comments? Thank you for sitting there patiently. All in favor, please say aye. Aye. Any opposed? That motion carries. Moving on to information technology. I'd like an omnibus motion for items E1 and 2 to send the temporary waiver to the schedule of authorized permissions for the IT department and to send this budget amendment to the full board with a recommendation for approval. Could I have such a motion? I see Mr. Esri and Mr. Hardkey. I'm going to ask questions, and this be directed to Ms. Busey as the proxy for the IT department. Do we have any comments or questions? Sure.
The IT
You don't want a
department
technical
is
answer.
behind the window, and he will come out if necessary.
I want you to bang on the glass and see if he's awake back there. If there are no additional comments or questions, I would ask all those in favor signify by saying aye. Aye. Any opposed? We'll go to the full board. Moving on to other budget amendments and transfers. Number one, $10,000 for the county clerk automation fund. May I have a motion to send this to the full board with recommendation for approval? Moved by Mr. Kurtz, seconded by Mr. McGuire. Any discussion of this item? Questions of the clerk? Ms. Petrie.
Holton, which I asked at caucus, you're shifting money out of your automation fund to cover this. Will that cause you a shortage when you are ready to buy some more equipment?
Thank you. That's an interesting question. We don't generally use the automation fund for election equipment. We use the automation fund for technology-related equipment purposes in the office. If you'll recall, over the last couple of budget cycles, In 2011, our automation fund was very nearly fully emptied. And we've made a concerted effort to try to accumulate a little bit of a fund balance there, sort of as a contingency fund. This particular position is the position, you may recall, that was transferred from our office to the IT department. So it's a general corporate fund position. This is the program analyst who technically works for the IT department. This person has reached the maximum number of compensatory time hours. We didn't anticipate this because this person doesn't technically work for us, so we don't see their payroll. The IT department hasn't budgeted for overtime. The work that this person is doing is directly related to our office, so we don't feel like the IT department should be responsible for covering the overtime. This seemed like a reasonable accommodation to cover the overtime for this employee who's really doing work on behalf of our department without negatively impacting the general corporate fund.
Thank you. Any other comments, questions? Seeing none, all those in favor, please say aye. Aye. Any opposed? That motion carries. Our next item is a budget amendment 14-6, increased appropriation of $10,898. Again, this is with regard to the Public Safety Sales Tax Fund, with regard to the way we're accounting for the JANO maintenance contract. May I have a motion to send this to the full board with a recommendation for approval? Moved by Mr. Langenheim, seconded by Mr. Hartke. Any discussion of this? Questions? Seeing none, all those in favor, please say aye. Aye. Any opposed? That motion carries. Final budget amendment for the evening is Budget Amendment 14-8. This is revenue neutral for $65,000 for the Regional Planning Commission, accepting a United Way grant for homeless services. May I have a motion to send this to the full board with a recommendation for approval? Ms. Michaels. May I have a second? Ms. Cowart. Any discussion, questions, or comments? Seeing none, all those in favor, please say aye. Aye. Any opposed? That motion carries. Let's move to the addendum. We've got a budget amendment 14-9. This is $2,450 for general corporate. Apparently, we stole some of the Martin Luther King donations for 2014 and used them in 2013, so we're cleaning that up. May I have a motion to make sure that these are sent to the proper year? I see Ms. Cohort. Is there a second? Mr. Hartke. Any discussion? All those in favor, please say aye. Aye. Any opposed? Thank you. That motion carries. Back to the main agenda. Item G, 1 and 2, with the county administrator. May I have a motion to accept the county administrator's report and place them on file? Moved by Mr. Hartke, seconded by Mr. Harper. Ms. Busey.
This is the final fiscal 13 general corporate fund report. You'll see on the revenue page, I've highlighted in yellow state reimbursement, and there's a reason for that. We are paid by the state for the salaries of probation officers quarterly, and this quarterly payment was the 5th quarterly payment to be deposited to fiscal 2013 because they pay late. So when we received it in January, historically, that would have gone to the next fiscal year, but the services were actually provided in the previous fiscal year, so it was deposited to 2013. That is one large factor in the fiscal year revenue excess that we see with fiscal 2013. If you look at expenditures on the next page, you'll see that we basically underspent in all areas of the budget with the exception of transfers and debt payment, which brings us to a summary report, which, remember, this is budgeted, this is not cash, so this doesn't match what the treasurer told you earlier. But the ending fund balance for fiscal 2013 is at $6 million, which is good. It's totally attributable to the fact that we posted revenue for an extra 30 days because we closed the fiscal year after 60 days instead of 30 days. And we had very little additional expenditure in that 30 to 60-day window, but there is a substantial amount of additional revenue. So this is a correction that will always carry forward because we're always going to close our fiscal year after 60 days from this point forward. It's somewhat fortunate, as Mr. Alex pointed out earlier, that we decided to make this change at the same time that we adopted a 13-month budget. But the bottom line is, based on the 2013 budget, that's an 18.36% fund balance, but highlighted in yellow, which is really, it's the beginning fund balance for fiscal 2014, it's a 15.04% almost 9% fund balance, which is the healthiest fund balance we have seen, and that's against a 13-month budget, not a 12-month budget. So that's the healthiest fund balance we've seen in a while, and I think the treasurer would probably concur that in the past few years, based on the report he provided you, we would not even have been able to entertain the thought of not doing that public safety sales tax loan sooner than what we're looking at for this year. So we are getting to a point where this fund balance may be rising to the level that it should be. I mean, I think if it were at 18% against, 15 to 18% against the next 12-month budget, we would probably be in good shape, and that remains to be seen. And then the last page is the budget change report, which is all the changes that you made to the general corporate fund budget during fiscal year 2013.
Thank you, Ms. Busey. I mean, I think this is great news. It's not quite as good news as it looks on paper. As I said in my
No,
memo,
it's
we don't
not.
really have an extra $1 million that we didn't think we had, but the point is fiscal year 2013, we ended very well. There's, thousands of people who are responsible for that, and I wish I could personally thank everybody here, but hopefully we'll see equivalent performance in 2014, so thank you to everybody. May I have, I guess we'll go to a vote to accept the report and place on file. I'll say aye. Aye. Any opposed? Thank you, Deb. Moving on to the resolution for the abatement and reduction of taxes heretofore levied for the payment of bonds. May I have a motion? Moved by Mr. Esri, seconded by Mr. Kibler. I apologize for the confused description of this I gave in my memo. If anybody has any questions, I'd be happy to try to explain it better. And thank you to Ms. Schwartz for keeping me honest. Seeing no comments or questions, I would ask all those in favor to say aye. Aye. Any opposed? That motion carries. Moving on to the resolution for authorization of loan to the general corporate fund for the public safety sales tax fund, from the public safety sales tax fund. I think the treasurer covered this earlier. Motion by Mr. Kurtz. Anybody want to second this one? Second by Mr. James. Are there any questions of Ms. Busey or the treasurer on this, or are we clear on this? Okay, all those in favor, please say aye. Aye. Any opposed? That motion carries. Our next item is a recommendation for establishment of elected official salaries for officials to be elected in November 2014. I would ask that we have a motion to accept the county administrator's recommendations for the purpose of discussion. Mr. Langenheim and Mr. Hartke. Deb, would you like to touch on this? Defend yourself?
Okay, this recommendation is to reinstitute some equity among our elected officials based on the size of the jobs that they have and how they have historically been classified. That equity went away in the time period when you last set these elected officials' salaries. We were in the midst of the economic crisis, and the officials whose salaries were set in the 2 years before that were still receiving 4% pay increases. So part of this recommendation, and this applies to the county clerk, treasurer, and circuit clerk, which 3 jobs were all identified to be of the same size in terms of responsibility and authority, and were deemed to be larger by 4% difference in compensation than the coroner, auditor, and recorder, which jobs were deemed to be somewhat smaller in terms of responsibility and authority. So with this recommendation, at a 2% annual increase for the first 2 years, you're setting for the county clerk and treasurer. The other group, coroner, recorder, auditor, are currently on a 4-year cycle of 0% pay increases. The equity, the internal equity between those positions that was established almost a decade ago would be re-realized if you gave 2% increases to the county clerk and treasurer for the first 2 years of this next cycle of this setting of 4-year terms. So that's part of the explanation. The rest of the explanation is in looking forward, when we look at our 5-year projections, when we look at overall salaries, we would anticipate that 2% is basically what the standard will be, hopefully, for salary increases for county employees. And certainly, you've seen this with non-bargaining employees. This has been effectively where salary administration guidance from you has landed for those employees with regard to negotiating contracts. Can't really talk about that, but overall, the growth in wages for for personnel is anticipated to be at 2% per year. So that's the other basis for the recommendation as you move forward, and equity. And then there's the issue of comps, and Champaign County is the largest of the 5 counties that we do comparables with. And basically, the Champaign County officials are close to the lowest end of compensation when you look at those comparables. This is not going to change the position of the county's elected officials. They'll probably still stay in a position where they're paid less than with the other county comparables, but I don't think we should lose more ground than where we already are, because, again, when you look at comparables, the sheriff in a county the size of ours probably may have more demands on him than the sheriff of a county that's got a population of 50,000 fewer people, which is basically where Rock Island County is. And Sangamon, Peoria, and McLean fall between the two. So those are the essential basics of the recommendation, and I'm happy to answer any questions, or if you have different ways in which you would like to look at this, I'm happy to provide that information for you. This is something that you're not required to vote on tonight. You do have to vote on this by your May meeting. However, these salaries have to be set 180 days before the individuals take office.
Floor is open. I see Mr. Mitchell and I see Mr. Maxwell.
Just how does that relate with the cost of living increases?
Well, I can't predict cost of CPI for future years. Cost of living last year was 1.7, okay. The way we figure cost of living is what we use for the PTEL calculation. So in January, we received the CPI for the previous fiscal year. It was 1.7 for fiscal 2013. It's 1.5 for fiscal 2014. But when these employees went through years of wage freeze, there were cost of living adjustments in those years too, where they received nothing, which is why I provided you the historical piece, which is the last 2 pages. I mean, to go through, and there are many times when the cost of living doesn't match what the elected official salary increases are, and that's because you have to do it proactively. You have to do it before those numbers are known. So based on the current, what we know about the economy today and how the economy has been growing, you know, it's in the ballpark, I would say.
Okay, thanks.
I'd also point out that the PTEL formula is based on the consumer price index as
Right.
opposed to the cost of living index,
Right.
which is another reason the PTEL formula is stupid. I'm looking at you, General Assembly. Who's next? Mr. Maxwell.
I appreciate your effort in compiling these figures and presenting them to us, Deb. Would a motion to defer this discussion to the March 11th Cal meeting be in order?
It would if you are making one.
I so move.
There's a motion to defer to the
March 11th.
March Committee of the Whole meeting. I'm sorry, who seconded? Ms. Petrie seconded. Discussion on the motion to defer. Mr. Quisenberry.
Yeah, I would like an explanation of the reason for deferral, just to know.
Anyone can feel free to give one. I'm sorry, Mr. Langenheim. Mike.
Why should we defer?
Thank you, Mr. Langenheim. Any further discussion? Mr. Maxwell?
I would just we have plenty of time, and I'd like to have a little more time to study this and hear and listen to my constituents. I do have one call from a constituent I have not answered yet. In general, I'm not against this. I'd just like to have a little more time to look at it. Thank you.
Thank you, Mr. Maxwell. Ms. Schwartz?
I would like to get, whether we defer the discussion or not, some more information about the total pay for the county board chair, and it has nothing to do with the current board chair, because we're talking about the next one, so this is not a statement about the county chair right now, okay, just to be clear.
I'm sorry, Ms. Schwartz, are you?
Well, what I'm talking about is
What do you
there
need
is
to
a
know?
pay and then there is a per diem, which probably adds up to several $1,000s. So I would like to know the total cost. And as it is, we are currently, even with the base pay, higher. And I think there's a significant difference between other elected officials that are running for a job, and they know ahead of time, whereas county board chair, when they run for their district, they don't know that they'll be chair or not. So it's a little bit different in terms of saying, well, we need to pay them enough so they're willing to run. Well, that's not really relevant for county board chair, because county board chair doesn't know they'll be chair until they're elected by the sitting board.
I
So-
appreciate that you've gotten that out there, but I'm going to call it out of order with regard to the motion to defer.
Well, I'm just saying, if we defer, by the time we get the deferral, I would like to get that additional information, so we don't have to defer it again, so Ms. Busey can come back with the information.
You very artfully evaded my parliamentary gambit. Any further discussion with regard to the motion to defer? I think the county administrator heard you. Seeing none, all those in favor of deferring this to the March Committee of the Whole, please signify by saying aye. Aye. All those opposed, nay. I'm going to ask for division. It's been called for division. All those in favor of deferral, please raise your hand. Yeah, we're done. Okay, that's deferred. And our next item, request to release a bid for x-ray equipment for the Champaign County Coroner. This does not go to the full board. We can deal with this here. May I have a motion? Moved by Mr. James. Is there a second? Mr. Richards, any discussion or questions? Coroner isn't here, but we'll do our best. Mr. Quisenberry.
I think, if somebody can correct me, I think this is a piece of equipment that's been broken that he's trying to replace.
That's correct.
Thank you.
It is budgeted in his capital budget for this year.
Ms. Petrie.
I haven't had time to read this carefully, so the answer may be in this document, but what's the ballpark expected cost of this equipment?
Budgeted, anticipated is right at about $38,000, and he had done some research to come up with those numbers.
Okay, thank you.
Any additional comments, questions, or discussion? Seeing none, all those in favor, please say aye. Aye. Any opposed? That motion carries. We have a request to accept the recommendation of the Job Content Evaluation Committee for the Public Defender Investigator position. This is what was already discussed under Mr. Quisenberry's committee. May I have a motion? Moved by Mr. Schrader and seconded by Mr. Kibler. Any discussion?
Good night.
Seeing none, all those in favor, please say aye. Aye. Any opposed? Okay, we have a little bit of other business as a result of potential conflict. Ms. Catherine Emanuel has had to step down from the nursing home RFP committee. And Dr. Robert Plinkus, who is also a member of the nursing home board, has indicated that he would serve in her stead, and it gives me pleasure to appoint him to that committee. I would like to also note, on Friday, we had the vendor pre-submission conference where questions were answered of potential respondents to the nursing home RFP. Mr. Van Anderson was there and gave very concise answers, which will be sent out in writing to all the potential bidders. Ms. Busey was there as well. My understanding is that at last count, we had 7 parties that had expressed an interest in responding, so I think that's terrific news. We should get some exciting ideas out of them. One more comment. I will not be here for the March Committee of the Whole meeting. Ms. Michaels, who is the Deputy Chair of Finance, will not be here for the March Committee of the Whole meeting. So I've asked Mr. Richards if he will chair Finance Committee of the Whole in March, and he has indicated that he will probably be able to do that. So I would plan on seeing him in the chair in March. Thank you. Items for consent are... Where'd my paper go? Did you take my paper?
Aren't they all?
It was on my addenda. I think everything. I all
think
stole my paper.
everything went.
Items for consent are everything, A2 and 3, D1, E1 and 2, F1, 2, 3, and 4, G3, 4, which one was the one that got deferred? 5? G3, 4, and 7. Thank you. That concludes finance.
Is there any other business? To adjourn. One.
It's that
Second.
vodka. Put me to
Second,
sleep.
Stan. All in favor? We're adjourned.